Mpox infections are on the rise in Toronto. Public health officials say 21 cases of the virus have been confirmed in the city since the start of the year. This is compared to just 27 cases in Toronto all of last year. Right now, we're joined live by Dr. Rita Shaheen, Toronto Public Health Associate Medical Officer of Health. Dr. Shaheen, thank you very much for your time this afternoon.
Thank you.
Let's start off with this. I mean, not to be flippant, but I thought we were past Mpox.
So we're seeing a small increase in cases since January 1st, as you mentioned, 21 cases. And we know that most of those cases are due to local transmission, so people picking up the infection here in Toronto. Only a couple of people likely picked it up on, traveling elsewhere abroad.
Okay, so relative to, the actual size of the population here, it sounds like a small figure of cases.
It is a small number of cases, and we're not expecting to see the large number of cases that we saw in 2022 with over 500 cases. We know that many eligible people have gotten their first dose of vaccine, but not many came back for second dose. And of the 21 cases that we've seen since January 1st, only 3 of them had had 1 dose of vaccine and the rest were unimmunized. So it's really an important reminder to people who are at risk that they should get their first dose and followed up with a second dose as well.
And Dr. Shaheen, please be explicit. Why exactly is this raising concern with such a small number?
Well, it's really, we just wanted to raise awareness for people who are at risk, gay and bisexual men who might be at risk of acquiring the infection, that it's still circulating, even though it's low levels in the city. And we don't want to see a bigger increase. So it's really an important opportunity to remind people to check their vaccine records and get the vaccine if they're eligible.
And Dr. Shaheen, can you go over symptoms as well as exposure, what you should do?
So people who get exposed to the virus, it's usually spread through very close skin contact. So sexual activity is, one of the ways that most people are picking this up. And symptoms can occur, 5 to 21 days after you've been exposed to somebody, most often starting with fever. People may feel very fatigued, have swollen lymph nodes, have a headache. And then there's a rash that it can appear either before or after the fever, most commonly afterwards. And the rash usually appears at the site of exposure, so often in the genital area, but can occur on the face, on the body, anywhere that people have had skin-to-skin contact.
And along with that, the best way to mitigate your exposure to this or your risk?
Absolutely. The best way is to get the vaccine if you're at risk and eligible for it. Check on our website, toronto.ca, for a list of our vaccine clinics and the eligibility as well.
Okay, Dr. Rita Shaheen, Toronto Public Health Associate Medical Officer of Health. Thank you.
Thank you very much, Bakari.